So we're going to see questions 60, well, 30 questions on implants. Immediate loading, difference between stage 1 and stage and 2. Vascular bundle below the bone. What is the okay, these are backwards. Okay. What is the difference between stage 1 and 2? The immediate loading. What is the similarity between bone and implant? Vascular bundle below the bone. What kind of bacteria is under the implants? At the apex of the root canal, gram-negative rods, filaments, anaerobic. Which bacteria is responsible for implant failure? Gram-negative anaerobes. Best bone to place implant, mandibular anterior. Worst bone to place implant in, posterior maxillar. Bone necrosis occurs at 47 degrees Celsius 1 to 5 minutes. Best reasoning for implant in maxillary lateral. Best reasoning for implant in maxillary lateral, no rest of central and canine. Least important factor when evaluating for implant: concavity of mandible, bone density, distance to mandibular canal, bone width. All of them are important, except the least important is concavity of the mandible. Distance from implant to implant, 1.5 millimeters each, so 3 millimeters in total, because they need enough blood supply in that 3 millimeters, 1.5 each. Implant to tooth, 1.5 millimeters. Implant to nerve, 2 millimeters. Minimum ridge width of for 4 millimeter implant, 6 millimeters. It has to be the 4 millimeters of the implant plus 1 in buccal and 1 in lingual. Minimal vertical height of bone to place implant, 10 millimeters. Minimal vertical height of bone to place implant, 10 millimeters. Minimal width of the bone, 6 millimeters. Minimal distance of implant above the nerve, 2 millimeters for vital structures. Between implant and tooth, height of contour, 1 millimeter. Platform of implant from adjacent cement to enamel junction, 2 to 3 millimeters. Mini implant, 2 to 4 millimeters, 2.4 millimeters. Where there is fixed partial denture from natural tooth to implant, the max stress is concentrated on the superior portion of the implant. If implant and bridge are done with natural tooth, what is the complication? Lots of force on the implant crown. This will cause a fracture. How do gingival fibers orient next to the implant? They are oriented parallel with the cuff. Implant complications and control diabetes, immunocompromised, actually not implant complications but contraindication. Immunocompromised, control diabetes, volume and height of bone amount you have to work with. Bisphosphonate therapy, bruxism, tobacco use, cleft palate, and young kids. Adolescents should not get implants. They have to wait until after 18. Older people can get implants. There is no contraindication except for as far as age. Does not affect implant success age. Implant treatment better option for smokers than period surgery because period surgery in smoker doesn't work as well as a non-smoker. Again, implant treatment is better option for smoker than period surgery because period surgery in smoker doesn't work as well as a non-smoker. Is this true or false? Neither the statement or the reason is true. Again, implant treatment. Implant treatment better option for smoker. Okay. Next question. When getting crown for implant, what occlusal scheme is preferred? Metal occlusal. When you use screw over cement retained, when there is not enough occlusal space, you don't have space occlusally, you use a screw. Need more interocclusal space for cement. What is the purpose of hex screw? Anti-rotation. Prevents rotation of the crown. Component of the implant that replicates implant in cast. Component of the implant that replicates implant in cast. An analog. Implant analog. The implant analog is a component of the implant that replicates implant in the cast, the analog. How well, most important for osseointegration, how well the surgical procedure is managed. What is the most important part for osseointegration? How well the surgical procedure is managed. When do you check occlusal before place of abutment? Oh, osseointegration. When do you check osseointegration before the placement of the abutment? Osseointegration of implants should be assessed prior to placement of restorative abutment. When do you use a stent? Angulation. Make sure implants are aligned properly. A stent can be used when you need to make sure the implants are aligned properly and are checking for angulation. If implant is inclined too buccally and you don't want the screw to be seen in the buccal surface, what do? You use an angled abutment, a custom abutment, and cement it down. If implant is inclined too buccally and you don't want the screw to be seen on the buccal surface, what do? Angle or a custom abutment and cement it down. Preload of implant is comparable to a compressive force. Preload of implant is comparable to compressive force. Preload of implant is comparable to compressive force. Advantage of open tray technique: it reduces the effect of implant angulation. To transfer the exact angle of the implant and is more accurate. That is the advantage of an open tray technique. It reduces the effect of the implant angulation. Next, implant success is determined by mobility. Main reason the implants fail: surgical error. Most common implant failure it doesn't osseointegrate. Most common complication of crown: screw loosening. Most important thing about implant success: osseointegration. Why implants fail? Because of no osseointegration. Major mechanisms for destruction of osseointegration are similar to those of natural teeth. Major mechanisms of destruction of osseointegration are similar to those of natural teeth. What causes the greatest incident of implant failure? Overheating. Worst type of force for the implant: vertical. and you will see a widening of crestal bone. Next, in anterior maxilla, for a 4 millimeter diameter implant, how far apically to the cemento-enamel junction of adjacent tooth for optical emergence profile? 2 to 4 millimeters below cemento-enamel junction of adjacent tooth. Actually 2 to 3 millimeters. 2 to 3 millimeters below the cemento-enamel junction adjacent to the tooth. Implants are placed below the gingiva, 2 to 3 millimeters below adjacent tooth. All are trauma for occlusion on an implant. All are trauma from occlusion on an implant, except gingivitis. Gingivitis will not be seen when you have trauma on occlusion. Implant supporting bridge. You have an implant supporting bridge and one doesn't fit, section and index. Section and index. Water is used when placing implant for cooling. Irrigation with saline and implant surgery. Alkaline irrigation is important to prevent bone from overheating. Implant supported removable partial denture. Where to put occlusal rests? None. You do not put rests on a crown for a removable partial denture. Do not place implant in kid until 18 to 20 years old. How to clean implants, plastic scale and gold probe. It cannot be stainless steel. What not to use for cleaning implants? Stainless steel. Patient with implant. Patient with implant. Do the connective tissue and epithelium attach the same as they do to natural tooth, meaning biological width? The epithelium attaches the same, but not the connective tissue. Epithelial attachment for implants will be through hemodesmosomes. Epithelial attachment connects, but not the connective tissue. Epithelial attachment for implants, hemidesmosomes. How many implants to place in anterior? Maxilla 4, mandibular 2. After implant placement, an edentulous patient should avoid wearing anything for 2 weeks. After implant placement, an edentulous patient should avoid wearing anything for 2 weeks. When placing implants in maxillary central, most important thing to consider in aesthetics, the emergence profile. So we're going to go back to oral surgery. We're going to do another review. So how warfarin works on anticoagulant. Warfarin, which is Coumadin, and will work depleting the potassium that is needed for factors 2, 5, 7, and 2, 7, 9, and 10. 2, 7, 9, and 10. How warfarin works as an anticoagulant. Coronary infarct medication, dicumarol. Dicumarol works in the same way as warfarin or Coumadin. Dicumarol. Dicumarol, coronary infarct, myocardial infarction. INR levels that are good for treatment between 2 and 3. The normal INR 0.8 to 1.2 or 1. Higher, if you have higher INR, you'll have more bleeding. You suspend warfarin how many days before extraction? 5, according to these notes. 5 days before extraction, you suspend warfarin. Can treat patients with INR greater than 3.5. Vitamin Um, what do you need to supplement a comedian patient? Vitamin K. Best way to determine platelet function, bleeding time. Bleeding time. Aspirin will affect the platelet count. Next question of true or false. Aspirin has no effect on PT, PTT, and INR. It does not have an effect. It has an effect on platelets. It is true. So aspirin has no effect on PT, PTT, or INR. Prostaglandins affect GI. What is a prostaglandin effect on GI? Decrease gastric acid and increase gastric mucus. So if you have, okay, so prostaglandins will increase mucus and decrease gastric acid. So if you take a prostaglandin inhibitor like aspirin, you will, or other cyclooxygenase inhibitors, they will decrease the gastric mucus and increase the acid. So you could have patients with ulcers in the stomach. What makes prostaglandins? Arachidonic acid. Arachidonic acid makes prostaglandins. What medication cannot be given with a person that uses ginseng antiplatelet? Okay, a patient that uses ginseng, you cannot use warfarin or comedine. Ginseng biloba or ginkgo biloba. Yes, ginkgo biloba is contraindicated in patients that take warfarin or comedine, and ginseng is an antiplatelet. Ginseng antiplatelet. What is the normal hematocrit? 38 to 54%. Normal hematocrit, 38 to 54%. Normal hematocrit.
Normal hematocrit. Normal hematocrit. 38-54%. Normal hematocrit.
Normal hematocrit. So we're going to see a complete blood count, CBC, and urinalysis are two tests that should be done before using a general anesthetic or for surgical procedures. If a bleeding problem is suspected, PTT is also evaluated. A CBC test includes hematocrit, the volume percentage of red blood cells in the whole body. Normal is 45 to 50%. Normal female, 45 to 50%. Okay, normal male, 45 to 50%. Female, 40 to 45%. So the red blood cell count will be a little bit lower in women. Men, 45 to 50. Women, 40 to 45. Hematocrit is the amount of your blood that is occupied by red blood cells. It's like chocolate milk. How much is chocolate versus how much is milk? Hematocrit is the volume percentage of red blood cells in your body. Normal male, 45% to 50%. Normal female, 40 to 45%. The minimal acceptable value of hematocrit is 30% for elective surgery. Okay. So the normal hematocrit is of a male 45 to 50%, normal female 40 to 45%. Anticoagulation action. Anticoagulant action of warfarin or comedine is antagonizing the vitamin K, by antagonism of vitamin K. Extraction of socket still bleeding 5 hours later. What do you do? Refer for INR. INR. After, INR is the ratio of the prothrombin time measured in the patient divided by a standard thrombin time value and multiplied by a constant. Patients on anticoagulant therapy may have excess bleeding after dental treatment. Always check the patient's medical history. If the patient is on anticoagulants, have their physician provide documentation of their INR values to assess anticoagulant effects. INR is the ratio of the prothrombin time measured in the patient divided by a standard prothrombin time value multiplied by a constant. The higher INR, the greater the anticoagulant effect, greater clotting. For example, an INR volume of 1 means normal prothrombin times of about 12 seconds. Normal blood clotting would be present. If the INR is over 1, indicates an anticoagulant effect exists. Many patients taking anticoagulants have INR values of 2, 3, 4, 5, and even 6. For surgical procedures, an INR of 1 to 1.5 indicates a normal prothrombin time. This is within a safe range. So I have here that I have been told many times that 3 is a good number for surgery, but this says 1 to 1.5. So I don't know. We're gonna see what else we can see about INR. And socket still bleeding 5 hours later, what do you do? Refer for INR. Extraction and hemorrhage after 3 days, what is the cause? Fibrinolysis. Extrinsic pathway is measured by INR. Normal PTT, 25 to 35 seconds. Normal PT, 10 to 14 seconds. PT is shorter, PTT is longer. Normal PT 10 to 14, normal PTT 25 to 35. Intrinsic factor PTT, extrinsic PT. PT factors 2, 7, 9, 10, which are dependent on potassium. PTT factors 8, 9, 11, 12. Intrinsic, okay? Intrinsic factors. Remember 12, 11, 9, 8 intrinsic, 10, 9, 2, 10, 2, 7, 9, 10 intrinsic. Hemophilia A, factor 8. Hemophilia
A, factor 8.
Hemophilia 8.
Hemophilia A, factor 8.
Hemophilia A, factor 8. Ginkgo biloba drug contraindication, heparin. Heparin? Wait. Hypoglycemic drug for diabetes, sulfonylurea and metformin. Why don't give sulfonylurea to type 1 diabetic? Because sulfonylurea, what does is increase the production of insulin by beta cells of the pancreas, and patients with type 1 diabetes don't have beta cells for insulin. Metformin is a Metformin is first line of medication for treatment of type 2 diabetes, particularly for overweight people. Um, it can also be used for polycystic ovary syndrome. Sulfonylurea action, stimulation of insulin release from beta cells, decreases glucagon level, metformin and sulfonylurea. Metformin and sulfonylurea decreases glucagon levels. Hemoglobin A1C is the measure of glucose levels over expanded periods. What is the normal HB hemoglobin 1AC minus less than 5.7? A pre-diabetic hemoglobin 1AC is from 5.7 to 6.4, and a diabetic is more than 6.5. Too much insulin does not lead to hyperglycemia. Sign of hypoglycemia, diaphoresis. Risk factor for hypoglycemia, alcohol. True or false? Controlled diabetic has same period problems as non-diabetic. True. Controlled diabetic has the same period problems as non-diabetic. Yes. The diabetic patient don't have an increase in gram-negative clavicular fluid. Diabetic patients don't have increase in gram-negative clavicular fluid. What is a patient in a classification ASA 3? That's an uncontrolled diabetic. An uncontrolled diabetic is in classification ASA. Contraindication for elective endo treatment, diabetic. Type 1 diabetes leads to blindness. Dialysis patient went to do treatment one day after dialysis. Insulin shock, what do you give? Orange juice or oral sucrose? Insulin shock, what do you give? Orange juice or oral sucrose? Unconscious diabetic, 50% dextrose in water IV. Instruction for diabetic patient before surgery, low calorie food and reduce insulin dose. Actually, IV sedation for diabetics scheduled in the morning. If insulin dependent, have them not eat, not take shot in. Okay, low calorie food. Instructions for diabetic patients before surgery. Low calorie food and reduce insulin dose. Actually, IV sedation for diabetics scheduled in the morning. If they're insulin dependent, okay, I don't know about that. Diabetic drugs classified by duration of action. Ketone breath is associated with diabetes type 1 and hyperglycemia. Dyspnea and orthopnea seen in congestive heart failure. Dyspnea and orthopnea, congestive heart failure. Common heart problems in children, ventricular septal defects. Common heart problems in children, ventricular septal defects. Peripheral edema, cardiac heart failure. Peripheral edema, chronic heart failure. Digitalis action, blockage of sodium potassium ATPase and increased calcium influx. Ginseng is contraindicated with aspirin and warfarin. Okay. Myocardial infarction and arrhythmia difference, thrombosis. Angina at rest, unstable angina. Side effect of nitroglycerin: orthostatic hypotension and headache. Nitrates or nitrates, vasodilation, decreased blood pressure, and tachycardia. Nitrates, vasodilation, decreased blood pressure, and tachy. Epinephrine plus nitroglycerin, they are antagonists. Epinephrine and nitroglycerin are antagonists. Transient ischemic attack that should not be taken, nitroglycerin. Transient, transient ischemic attack that should not be taken, nitroglycerin. Beta 2 receptors for lungs, beta 1 receptors for heart. Wheezing sounds in asthma happen during expiration. COPD versus asthma: asthma problem breathing, COPD problem exhaling. COPD is also known as hyperventilation. Hyperventilation causes tachycardia and tachypnea. Palmar pits, cardiac heart failure, chronic heart failure. Soft tissue emphysema can be done in endo, also in extractions. Face swelling after air spray in period pocket, soft tissue emphysema. Crowding sound, COPD. Crowing sound. Theophylline is a drug used for asthma. Albuterol, also known as salbutamol. Severe asthma attack medication, aminophylline. Severe asthma attack medication, aminophylline. Singulair, it's a leukotriene, asthma and seasonal allergies. Most important thing when patient is wheezing, don't give O2. Most important thing when the patient is wheezing, don't give O2. Cause of syncope for pregnant women, pressure on inferior vena cava. All forms of shock have decreased perfusion to tissue. Hyperventilation syndrome. Hyperventilation, okay, sorry. 100% of oxygen good for what type of syncope? For what type of syncope except hyperventilation syndrome? It needs CO2, so yes, it needs CO2. Carpopedal spasm, hyperventilation. Grand mal seizures medication, Dilantin, which is phenytoin. Grand mal seizure medication, phenytoin, Dilantin. Most common seizure in children, febrile and grand mal. Febrile and grand mal are the most common seizures in children. Status epilepticus given what drug? Diazepam. Diazepam contraindication, pregnancy and myasthenia gravis. Also asthma. Drugs for petit mal seizure, valproic acid or ethosuximide. Ethosuximide. Drugs for petit mal seizure, valproic acid or ethosuximide. What causes seizure? Hyponatremia. Hyponatremia causes seizure. Seizure due to lack of what substance?
Cause seizure.
Seizure?
Seizure due to lack of what substance? Sodium.
Sodium. Seizure due to lack of what substance? Sodium. Least likely to produce respiratory depression? Midazolam. Describes the titration of diazepam to various sign for IV conscious sedation recommended as the endpoint. Describes the titration of diazepam for various sign for IV conscious sedation is it recommended as the ending point. Treatment of choice for lidocaine-induced seizures, diazepam. Drug is life-threatening when administered with MAO inhibitor, meperidine. Meperidine is life-threatening when used with MAO. Um, with MAO inhibitor.
Drug is life-threatening when administered with MOA inhibitor. Drug is life-threatening when administered with MOA inhibitor.
Okay, drug is life-threatening when administered with MAO inhibitor, meperidine. Meperidine, and let's see, meperidine. Meperidine is a synthetic compound of painkiller used as a painkiller drug, especially for women in labor. So, meperidine and MAO life-threatening when combined. Okay. Life-threatening when combined. So let's add here a okay. Well, I don't know how. Okay, so meperidine combined with a MOA inhibitor, an MOA inhibitor.
Drug is life-threatening when administered with MOA inhibitor.
MOA inhibitor drugs are going to be monoamide oxidase inhibitors. Monoamide oxidase, MAO, monoamide oxidase inhibitor, are drugs that inhibit the activity of one or both monoamide oxidase enzymes, which they are best known as powerful antidepressants as well as effective therapeutic pain, panic disorder, and social phobia. So monoamide oxidase inhibitors are a class of medication to treat depression. Okay, they're enzymes that help neurons fire throughout the body. It's formed in the liver and cleans up neurotransmitters in the brain once they've done their jobs. So you don't combine monoamide oxidases with meperidine. This is life-threatening when administered together. Next, opiate contraindicated in severe head injury cases. Next, opioid that is an agonist and antagonist. This is pentazocine. Opioid that is agonist and antagonist, pentazocine. A synthetic opioid, meperidine. Remember that meperidine cannot be used with monoamide oxidase inhibitors. Okay? Synthetic opioid, meperidine. Meperidine is a synthetic opioid. Opioid overdose symptom, hypotension and hypothermia. Opioid overdose symptoms, hypothermia and hypotension. Too much codeine will cause a patient to have cold and clammy skin. Opioid that does not have meiosis, mipyridine. Mipyridine, remember, is the one that cannot be used with monoamide oxidases inhibitors, and also it's a synthetic opioid, and it's an opioid that does not have meiosis. What is an antagonist? Something that has no intrinsic activity and has high affinity. Transdermal opioid, fentanyl. Transdermal opioid, fentanyl.
Fentanyl. Transdermal opioid.
Nalodipine increases withdrawal symptoms, contraindicated in heroin addicts. Nal, nal, nalbudip, nalbuphine. Nalbuphine.
Nalbuphine.
Nalbuphine. Nalbuphine contraindicated in patients um, with with heroin addiction. So here it is, nalbuphine. Nalbuphine is a synthetic opioid agonist, antagonist, analgesic of the phenanthrene series. Nalbuphine cannot be used in patients with heroin addiction. Mu receptors are located peripherally. Mu receptors are located peripherally. Allergy to codeine. What do you take for pain? Acetaminophen with aspirin, naproxen, or Demerol, which is mipyridine. Mipyridine. Remember that mipyridine is an opioid that does not have meiosis. Mipyridine is a synthetic opioid and it cannot be used with monoamide oxidase inhibitors. Mipyridine. Diphenhydramine, also known as Benadryl. Diphenhydramine, also known as Benadryl. Antihistamine causes less drowsiness. H1 second generation blocker. Antihistamine that causes less drowsiness. H1 second generation blocker, which is also H1 second generation blocker, antihistamine that causes less drowsiness. Least sedative effect, we'll find it in chlorpheniramine. Claritine is also known as laretidine. How does antihistamine work? It is a competitive inhibitor of histamine receptor. Property of Benadryl that causes xerostomia, anticholinergic. Benadryl is an anticholinergic, which is why it causes xerostomia. Histamine 2 blockers, cimetidine. All the deans, histamine 2 blockers. Gastric ulcer drug, H2 antihistamine. Gastric ulcer drug, H2 antihistamine. Ritalin. No, not Ritalin. Ranitidine. H2 blockers, antihistamine, ranitidine. All the deans. H1 blocker effect on the central nervous system, depression. H1 blockers. Remember that H1 blockers are not the same as H2 blockers. H1 blockers are antihistamines that cause less drowsiness, but will have a depression effect. Acetaminophen overdose drug and acetylcysteine. And acetylcysteine is an acetaminophen overdose drug. Acetaminophen overdose drug and acetylcysteine. Clopidogrel, also known as Plavix. Clopidogrel, also known as Plavix. Also known as Plavix. It's an antiplatelet medication that is used to reduce the risk of heart disease and stroke in those at high risk. It is also used together with aspirin in heart attacks and follow the placement of coronary artery stent. It is taken by mouth. Onset of effect is about 2 hours and lasts for 5 days. Plavix is clopidogrel. So saw palmetto, commonly known as saw palmetto, is a sole species of a palm, and this is contraindicated in saw palmetto in aspirin. Why? Because it heightens the anticoagulant effect. Aspirin and saw palmetto interactions. Saw palmetto and aspirin. Saw palmetto. Methotrexate toxicity increases with use of nonsteroidal anti-inflammatories or penicillin.
Methotrexate toxicity increases with use of
Methotrexate. Methotrexate. Anti-rheumatic